Blood clots are shockingly common. On average, one person dies from a blood clot every 6 minutes in the United States. Medically known as deep vein thrombosis or DVT, blood clots can form in any part of the body, but usually occur in the pelvis, thigh, or lower leg. When a part of a clot breaks loose and travels to the lungs where it causes a blockage, it's called a pulmonary embolism or PE. This is instantly an emergency room situation that cannot be ignored or delayed. In today's video, we look at 10 signs that alert you to a blood clot in the legs. We also reveal one hidden condition that causes blood clots and how you can prevent them. Number 10. Inflammation. Swelling in the legs can be a sign of a blood clot or thrombus, especially if other home treatments for inflammation, such as cold and hot compresses, cannot ease the symptom. The dense tissue and bone in this part of the body makes it difficult to break down or absorb clots naturally. If you experience unexplained swelling in your calf, ankle, or upper leg, seek medical attention immediately. Number 9. Redness of skin. There are many reasons a person's skin becomes red, such as sun exposure or an allergic reaction. If the redness is accompanied by dark patches, it could be a clot. These clots may get bigger over time for no reason. If you have redness that lingers after an injury or surgery, see a doctor. Number 8. Warm skin. The skin around the blood clot becomes warm to the touch and may even radiate heat. If the symptom persists and the cold compress doesn't help, see a doctor. Warm skin can also be accompanied by tingling and throbbing sensations. Number 7. Tenderness. The skin surrounding the clot may become sore or sensitive to the touch. Besides acute pain, this symptom frequently requires individuals to rely on their other leg to relieve the discomfort, which can lead to muscle and joint strain. Number 6. Increased heart rate. When a blood clot in the leg grows larger, the body goes into overdrive to eliminate it. Vital organs have to work harder, resulting in a rise in the heart rate. A higher heart rate can produce its own symptoms, such as shortness of breath and chest pains. A racing heart that cannot be attributed to physical activity or other recognized reasons should be assessed by a physician. Number 5. Fever. When a blood clot detaches and enters the bloodstream, some people develop a fever. This fever may be accompanied by chills, shivering, sweating, headaches, weakness, dehydration, fatigue, and body aches. In severe cases, the fever may shoot very high, resulting in mood changes, confusion, and other psychological anomalies. Number 4. Distended veins. Sometimes, distended or swollen veins may be a sign of a blood clot. Clots that become large can compress the surrounding blood vessels. People with varicose veins have an increased risk of developing blood clots in the deep veins of the leg. Number 3. Fainting. Fainting is often associated with low blood sugar or dehydration, but it can also be a sign of a blood clot. When a blood clot blocks the flow of oxygenated blood to the brain, you may feel dizzy or faint. If the blood clot moves to the lungs, you may have respiratory symptoms. Many people are unaware that a blood clot can cause a person to faint. This can lead to a misdiagnosis. Number 2. Fatigue. When a clot grows larger, the body's natural defense mechanisms go into overdrive to eliminate it. This can use up a lot of energy and resources, leaving a person feeling tired. Even after sleeping, a person may still feel tired and weak. If you have unexplained fatigue, it may be a sign of a blood clot, especially if you have pain, swelling, and redness in the affected area. Number 1. No symptoms. No symptoms may appear in about half the cases of blood clots in the leg until the clot detaches and becomes lodged in the lungs. There is a limited time period when doctors can treat or remove the clot before it causes deadly consequences such as pulmonary embolism. Next, what are the symptoms of pulmonary embolism? These include low blood oxygen levels, shortness of breath, rapid heart rate, pain in the chest, low-grade fever, and low blood pressure. Contact a doctor as soon as multiple symptoms appear. If caught early enough, treatments such as anticoagulants and thrombolytics can be administered, which may break up the clot before it causes any serious damage. Next, what are the consequences of deep vein thrombosis? The CDC estimates that 50% of those who survive a blood clot experience will have long-term consequences for the rest of their lives, and 1/3 will have another clot within 10 years of the first one. When blood clots damage the valves in the vein, they cause a condition called post-thrombotic syndrome or PTS. Symptoms of PTS include swelling, pain, discoloration, and, in severe cases, scaling or ulcers in the affected part of the body. Sometimes, these symptoms can be so severe that a person becomes disabled. Next, this condition that causes deep vein thrombosis is largely ignored. The condition known as high blood viscosity not only increases your risk of DVT, it also puts you at higher risk for heart disease, high cholesterol, stroke, metabolic syndrome, and diabetes. Having high blood viscosity means that your blood is very thick and sticky. This makes it harder for your heart to pump blood and increases the friction on the inside of your veins. As blood flow becomes sluggish, the amount of oxygen and nutrients delivered to your cells and organs is decreased. To learn about your blood viscosity, you can request a complete blood count from your doctor. A study from Edinburgh University in the United Kingdom showed conclusively that raised blood viscosity is at least as important as blood pressure and bad cholesterol in predicting death by heart attack. In other words, the quality of your artery walls is not the only thing that matters, the quality of your blood matters too. However, over the last 2 decades, mainstream medicine has been obsessed with reducing cholesterol levels through statin drugs, while largely ignoring high blood viscosity and the fatal blood clots it can cause. So, what can you do about high blood viscosity? One simple way to fix this is to get plenty of omega-3 fatty acids. Omega-3 fatty acids are natural anti-inflammatories, which means they help reduce inflammation. They also slow blood clotting and thin the blood. It should be mentioned that DVT in the leg, pelvis, and sometimes arm does not cause heart attack or stroke. The blood clot in an artery in the heart or brain, known as arterial thrombosis, is what causes a heart attack and stroke. Next, what can you do to prevent blood clots in your legs and improve blood viscosity? Avoid wearing tight clothing, especially when traveling. During long periods of travel, take time to move or stretch. Elevate your legs at least 6 inches above the level of your heart every day. See our video, Top 8 Ways to Improve Blood Flow to Legs and Feet. Keep your feet flat on the floor while sitting. Do not cross your ankles. Move around for at least 30 minutes every day. Consider graduated compression stockings if you are at risk for blood clots. Be careful of impact injuries to your arms and legs. If you're a woman taking birth control, ask your doctor about non-hormonal options. Eliminate excess sodium from your diet. This means avoiding processed meals. See our video, Top 5 Foods That Cause High Blood Pressure. Keep well hydrated and drink plenty of water. Quit smoking. To prevent blood clots, get our free anti-inflammatory diet plan by clicking the link below. As always, this video is educational and does not constitute medical advice. We are not doctors. If you enjoyed this video, like, share, and subscribe, and click on the bell icon so you never miss a video. And now over to you. What are you doing to prevent blood clots? Leave your comment below. We'd love to hear from you. Click the link below to get our free anti-inflammatory diet plan.